Do you know what happens during a stroke? A stroke is a severe medical condition that occurs when the blood supply to part of the brain is interrupted or reduced. This deprives brain tissue of essential oxygen and nutrients, leading to the death of brain cells within minutes. It's a medical emergency requiring prompt treatment. The silver lining is that fewer people are dying from strokes today than in the past, thanks to effective treatments that can also prevent disability. The symptoms of a stroke can be alarming. They may include trouble speaking and understanding others, sudden confusion, slurring words, or difficulty understanding speech. Paralysis or numbness of the face, arm, or leg is another key sign. This often affects just one side of the body. If you try to raise both arms over your head and one begins to fall, or one side of your mouth droops when you attempt to smile, you may be experiencing a stroke. Other symptoms include problems with vision in one or both eyes, sudden severe headaches often accompanied by vomiting, dizziness, or altered consciousness. Difficulty walking, stumbling, sudden dizziness, or a loss of coordination may also indicate a stroke. If you notice any of these signs or symptoms, even if they seem to come and go or disappear entirely, it's crucial to seek immediate medical attention. Remember the acronym FAST: face, arms, speech, and time. If a person's face droops when they smile, if one arm drifts downward or can't rise, if their speech is slurred or strange, it's time to call for emergency medical help immediately. Now, what causes a stroke? There are two main causes: a blocked artery, known as an ischemic stroke, or leaking or bursting of a blood vessel, known as a hemorrhagic stroke. Some people may experience a temporary disruption of blood flow to the brain, a condition called a transient ischemic attack, or TIA, which doesn't cause lasting symptoms. A hemorrhagic stroke happens when a blood vessel in the brain leaks or ruptures. This can be due to many conditions that affect the blood vessels, including uncontrolled high blood pressure, overtreatment with blood thinners, aneurysms, trauma, protein deposits in blood vessel walls leading to weakness, or an ischemic stroke leading to hemorrhage. On the other hand, a TIA, sometimes referred to as a mini-stroke, is a temporary period of symptoms similar to those of a stroke. It doesn't cause permanent damage and is caused by a temporary decrease in blood supply to part of the brain, which may last as little as 5 minutes. Understanding strokes, their causes, symptoms, and treatments is crucial. It allows us to act fast during a medical emergency, potentially saving a life and preventing disability. Stay informed, stay vigilant, and remember, time is brain.
How well versed are you in the knowledge of stroke risk factors? It's a topic worth delving into, as it's a condition that affects a significant number of people globally. So we're going to explore these risk factors in detail, to arm you with the knowledge you need to potentially avoid this life-altering event. Stroke risk factors can be divided into two categories: lifestyle risk factors and medical risk factors. Lifestyle risk factors are those that can be controlled and altered by making different choices in your daily life. This category includes being overweight or obese, physical inactivity, heavy or binge drinking, and the use of illegal drugs such as cocaine and methamphetamine. The second category, medical risk factors, includes conditions that require medical intervention and management. These are high blood pressure, cigarette smoking or secondhand smoke exposure, high cholesterol, diabetes, obstructive sleep apnea, and cardiovascular disease, including heart failure, heart defects, heart infection, or irregular heart rhythm, such as atrial fibrillation. A personal or family history of stroke, heart attack or transient ischemic attack, and COVID-19 infection also fall into this category. There are also other factors associated with a higher risk of stroke. These include age, as people over 55 have a higher risk, race or ethnicity, with African Americans and Hispanics at a higher risk, and sex, as men have a higher risk than women. Women, however, are usually older when they have strokes, and they're more likely to die of strokes than men. Hormone use, such as birth control pills or hormone therapies that include estrogen, also increases risk. The complications of a stroke can be temporary or permanent, depending on how long the brain lacks blood flow and which part is affected. These complications may include paralysis or loss of muscle movement, difficulty talking or swallowing, memory loss or thinking difficulties, emotional problems, pain, and changes in behavior and self-care ability. prevention is key in managing stroke risk. Knowing your risk factors, following your healthcare provider's recommendations, and adopting a healthy lifestyle are the best steps you can take. Many stroke prevention strategies are the same as those to prevent heart disease, including controlling high blood pressure and lowering the amount of cholesterol and saturated fat in your diet. In summary, the risk factors for stroke encompass lifestyle choices, medical conditions, and other factors such as age, race, and sex. Understanding these risk factors and taking steps to manage them through lifestyle changes and medical intervention can significantly reduce the risk of experiencing a stroke. It's crucial to maintain regular checkups with your healthcare provider to monitor these risk factors and implement strategies to mitigate them.